The Millennium Development Goal 5 targets reduce maternal mortality rate by 75% by enhancing access to healthcare facilities and disease control for expectant mothers in order to ensure self-deliveries. In every 2 hours, a mother dies in Kenya due to pregnancy-related illness. Kenya is on course in achievement of MDG 5, though at a slow pace.
As a country, we had been doing very badly. In fact, our maternal mortality rates is one of the worst. In fact, we are listed as one of the worst 20 countries in the world where a woman can give birth. So it has been that very bad, and a lot of this has been because access has been a major issue. So most women actually deliver at home. 6 out of 10 women deliver at home without skilled attendance.
Look, we are very far away from MDG 15. There is no way we are going to meet the MDG 15. But what MDG 15 did is to highlight the plight of and made key health indicators become our headline evaluators. So we need to monitor what we are doing. We need to go beyond MDG and move towards sustainable development goals. And as Kenya, life still continues beyond 2015.
President Uhuru Kenyatta announced the provision of free maternal services in all public health facilities from June 1st, with plans to reduce maternal deaths substantially from the current 488 deaths per 100,000 deliveries. 24-year-old Carol Mumbi is a beneficiary of this waiver, who delivered a bundle of joy free of charge.
For this free maternity, it's good because it's helping a lot of people who didn't have money. Everybody is going to benefit from this because it's helping everybody, not one. It's for all, rich, poor.
When this announcement was made, I think it came to us as the expert that probably access being sorted out, maybe we will be able to move very faster toward achieving our Millennium Development Goal 5, MDG 5. So it was surprising that when this announcement came up, then we saw the increase in numbers, which in this hospital was almost 100%. In fact, the cesarean sections even was 200% increase, and the numbers continue increasing to date.
In its 2013 1.6 trillion budget, the government committed 34.7 billion shillings to health, which experts argue is still below industry requirement.
There's definitely a huge budget shortfall. If you look at there was a 34 billion for the national and about 60 something billion for county government, and bring it to about 96 billion. But even if you look at that within the trillion budget, is still less than what is recommended, 15% budget for the health sector. And so with the free maternity coming in, it's a big shortfall.
We applaud the Ministry of Health with embracing the free maternal policy. It's by no means a small task. It's a big challenge. If you look at free primary education, you know what the cost implications were. There is no doubt there's a cost implication in the free maternal policy. But we as partners and stakeholders and private sector are going to support the ministry full-heartedly in this free maternal policy.
Kenya's private sector, under the umbrella body of Kenya Healthcare Federation, has partnered with the government to improve healthcare accessibility. One such initiative is a custom-made motorbike ambulance expected to speedily reach mothers in rural areas.
As a part of this private sector alliance, what we want to do is to make sure that those areas also benefit from our efforts and reduce maternal mortality. This motorcycles is just one of the components of what we have planned. There are other things we have planned to work with the private sector. How to get our health promotion messages on family planning, on how to stay healthy, right? Before you even get pregnant, right? How, even for men, how do you stay healthy?
Specifically, what we are aiming to do is galvanize support from the corporate sector. It's important for more corporates to be involved. There's a lot that corporates can bring to the table. It could be communication, it could be skills transfer, it could be funding to provide some of the essential things that are needed to improve the quality of care for maternal health services.
It's the goal of any company to increase the bottom line in all undertakings. Begs the question, why would profit-driven companies be keen on social responsibility geared towards maternal health?
All corporates do need to respond to the needs of our citizens. If you look at it, no matter which way, Our customers are women, our staff are women. We live with women, we live with mothers, we live with children. It's imperative for us to support better healthcare for women all around. So, it's just about interacting with your ecosystem and knowing how and where you can support it. The statistics are that, every 20 minutes a child dies, every 2 hours a mother dies in childbirth. It's almost like a silent epidemic because nobody talks about it, but it's imperative for us to respond.
The corporate dynamics is changing. If you want to be recognized as a corporate leader in any society or community, it's not just how much profits you make, but it's how relevant you are in the community. So from success, are you significant? So you can be a successful company, but you're not significant. So there are corporates in Kenya who are successful and also aspire to be significant. So this mix is what's driving corporates to make a difference beyond having just a single bottom line. They're looking at a double bottom line, that I make profits, but I also give back to the community.
The Ministry of Health plans to address this by employing more nurses and offering them better remuneration packages in a bid to improve access to speedy and quality healthcare service.
The government need to employ health workers urgently. Okay, I know they have set aside some money, but these things don't wait, and life you can't have it. People are coming to deliver, and if you don't give them the services, then quality is going to compromise. So you'll actually be shifting death from the household level, the community, to the facility, because these people come and there are not enough health workers and enough supplies to address these issues. So you may end up again having very bad quality and increasing, instead of decreasing the maternal mortality, which was the intention, but you'll end up increasing it.
It is expected that such maternal initiatives will pave way for Kenya in achievement of Vision 2030. With the over 1 million childbirths every year, mothers such as Carol have a reason to smile, and they will work towards raising the nation's future populace. For Ion Kenya, I am Laban, Onserio.